Hi. So my second guest is my dearest friend that I met back in 2020 when I was studying for the boards. Her name is Polly, and we have stayed in touch since then. She is so nice, and she made the time for me to ask her all the questions about the AGD and how the process went back then and how is she doing now. Hi, Polly. Thank you for
Hi,
coming.
Christy.
I was telling you that we have known each other for 5 years, and it's the first time I'm actually seeing your face after talking
Yes,
for years.
since 2020, studying for the boards.
Exactly. But I'm so
Yes,
happy we're able to keep in touch for all these many years
and
and
we
that we
could
follow each
achieve.
other.
Yes, and we could achieve our goals
Yes, that's the most important thing.
because when we just started, it was just like a dream.
Exactly. It
Yeah.
was a dream. It was, we want to accomplish this, and we did. Remind me, did you take the NBD or was it the MBD?
Part one and part two.
Was it
No,
like that?
I took part one and part two. I was in
Mm-hmm.
Brazil and
Mm-hmm.
then I came, I did part one, I came back, I
Mm-hmm.
started part two, and then when I moved, I did part two and I stayed.
That's what happened. I knew that we had this group of 20 people, and I knew the 20 people's stories, but with the years, all the stories
Yes.
rumbled in my head and got mixed together.
Yes.
So tell me, why did you choose to apply to AGD?
Because I always want to do something more clinical with not a lot of theory and exams, but that we could see patients in the first year. And I did some search. I went to the shadowing in the program, and I love that we do a lot of like things for fillings, SRP, and implants, even implants. We
Nice.
do in first year we start to see patients after we have 3 months of just theoretical part. We see all the basics to level up all the
The
class.
knowledge. Hmm.
Yes, and then we start clinic little by little until full time.
So you only have classes, limited classes, or is mainly clinical every day?
Now I have classes sometimes at lunch, but 1 hour. We don't have a lot of class anymore.
Mm-hmm. And as a first year, you get the basics you were telling me, but did you get any type of something new that you haven't seen in Brazil, for example?
Implants, we have some class of implants, a lot of perio, tissue regeneration like this is it's really good, and we have classes from specialists.
Have you done any perio procedures, tissue
Yes,
regeneration,
crown
crown
lengthening.
lengthening?
I did. I
Nice.
love it.
So, what is the goal for AGD in your program? I think you are in UF, University of
Yes,
Florida.
we go. So we want to be able to do
Everything you can.
general. Yes.
Hmm.
For example, if we have a case that we see that is not for general dentist,
Hmm.
we refer for specialist. For surgery, we do third molars. Endo, we do molars, but after all endos, we do a case endo consult.
Hmm.
We the specialist, our professor that is specialist, that he goes once per week and receive if we are able to do there or not. But usually we do molars, premolars, and we in our class there's more people like that with specialties,
Hmm.
so we help a lot each others as well.
How many are you in your class?
12.
Wow.
Yes, and it's really good because it is a small program.
Hmm.
So we have a lot of attention from the professors. All the cases we do a case presentations before we
Hmm.
start. We take pictures. We have photography classes. We take
Hmm.
pictures of the patients, and then we present the case to our faculties. And then, if it's needed, sometimes we do consults with specialties like perio or implant. And then, after all the case presentations, we go to the patient and we present the cases and we start the treatment.
Oh, nice. So it's similar to advanced standing because we used to do the same thing, except that we had many more classes. We have classes every day from
Yeah.
8 a.m. till 6 p.m. sometimes. And
Even at the end.
I know at the end, it was only, let's say, 3 semesters. We had classes every day. And then the last semester was only clinic mainly. But it was a lot of exams. I had exam probably almost every week. If it wasn't a final, it was a midterm. If it wasn't a midterm, it was a clinical exam. If it wasn't a clinical exam, it was an OSCE. I cannot tell you how many exams I had.
So we have at the beginning we have 3 months of just a theoretical part, but it's we have clinical protocol, we have prosto, and we have oral surgery. But some of the classes, almost all of them, we do presentations. If each one has a subject, sometimes it's like by lottery, like we do and sometimes they put what they want us to present, and we present to each others and we do a discussion.
That's good. Literature review type of thing.
Yes, we do. We present a topic. Each one has a topic. Do a presentation, and then after that we have a discussion with the faculties and
Nice. So you are 12 in total.
yes, if first year 12 and then second year 12.
What is the thing that you would say most about the program and the thing that you don't like at all or the least?
No, I love that we do a lot of things. We have a lot of support. We have mentor meetings that with feedbacks, what do we need to improve, what we are doing good. And they are really supportive in procedures that we've never done before, implants and others procedure. We are exposed to a many variety of procedures, and the amount of things that we learn, that we do there is it's a really good program with a lot of the faculties. They are really good, and comparing the amount of things that I learn, huge. I love this program. The thing that I don't like it, maybe it's like because I don't know if you know how it is, the school. It's small, it's very small there. So sometimes it's just because of the space. We don't have a lot of space over there. But
I've been to the one in Gainesville. I haven't been to that one in Hialeah that you're telling me about. Gainesville is huge.
yes,
I know that around the area there's not many things to do because I went there to take the hygiene exam when I was planning to be a
I did over
hygienist.
there.
And I was like, I stayed for a day and a half. And at night, during the day, it was nice. But at night, it turned dark. And I was like, where am I? This thing is so deserted. There's nobody here. But is Hialeah the same? Yes.
Hialeah
Okay.
is super small. Are like 2 floors, and we just have one classroom.
Oh my God, it's
Yes.
tiny. And are you the only ones there, or there's more people taking residencies?
No, just this program. It's impossible to fit more people over there. No, it's the only thing. But we have a
Uh-huh.
lot of patience. A lot.
That's
Yes.
it.
It's super good. It's like a family. I think because
Mm-hmm.
we are
Seeing each other every day.
yes, no, because it's a small program,
Mm-hmm.
because assistants they are there for a long period, and it's like a family. They take care of us. We always have a coffee
I see you guys eating all the
together.
time.
Yes, we always have to. We
So
celebrate
cute.
all monthly anniversary. It's super nice. The assistants treat us super well.
That's
The
nice.
faculty, it's like a family. We are always together. We are always helping each other.
Do you
It's
guys have assistants, each of you, when you are seeing patients, or they are rotating around the area?
in the first year they are rotating,
Mhm.
but in the second year is one assistant per two residents.
That's good.
Mhm. You
You
guys
know,
have
I have one for 8 residents or 6 sometimes. So it's
6?
hard.
Oh my God.
We are
How many
also in a
patients?
small room.
How many patients you guys see?
Well, we do long procedures, so it's usually top 2 patients during a morning, but at the same time, sometimes two people are taking an impression, final impression at the same time, and you're like, I'll just multitask myself, or you have to wait until the other person finishes, something like that. We
In the
need more.
but in the advanced standing, how was?
In the advanced standing, we didn't have assistants at all. We were 100 people seeing patients at the same
Oh
time in
my
both
God.
floors.
No,
So
so I need to tell them, my classmate,
yeah,
sometimes we complain.
no, no, no. You
It's just
guys have
not
it
for
really good.
you.
We didn't have anybody sectioning at all. We had a buy block that is called Mr. Thirsty that you would put and that has a suction included. That was your best friend. That was the best thing that they could have ever invented in their life because that thing would suction everything. But in the postdoc department, we have it too, but sometimes we don't use it. It also is the space is smaller. But I haven't prepped at all yet. I have prepped one tooth probably. So
Mhm.
because I
Yeah, you
July.
just started.
Yeah, so we are all in the treatment planning phase and all of that.
Mhm.
So let's see when I start actually doing things, how it's gonna
And
be. I
how
hope
great. And how many people
we
are
are
eight?
we are
Oh,
eight.
yesterday, look, we did, I'm doing a case and I prepped 6 teeth from canine to
Mhm.
canine. And we have exocad over there as well.
Nice. They're
Yeah.
teaching you that?
Sorry?
They're teaching you exocad?
Yes,
That's
they taught
great.
us. And then I did the WhatsApp and the exocad. And then I did an eggshell.
What? You're doing that? That's
Yes,
awesome.
yes. And then I prepped from canine to canine. And I opened the video. And then I used the eggshell to reline at the end. And it's my
Hmm.
second case doing that. That's why I love the program because we do
Wow.
a lot of things. We learn a lot.
That's good.
Mm-hmm.
I just started learning how to make the eggshells in the exocad literally 2 days ago or yesterday.
Mm-hmm.
So with these big cases, the relining is the hard part supposedly. How was your experience with that? Do you like it?
I like it, but what's difficult? Look, I blocked the morning and the afternoon with the same patient because I didn't know
Uh-huh.
how long it's gonna take.
Hmm.
And the patient had some problems with the insurance, and we could just start at 10:30 a.m.
Oh my
and
God, the
then
finance is always in there.
always. And then, but it was super nice, and I like
Oh
it.
my God, I need to see the picture of the finals, please.
I will.
I'm so
I did
excited.
this. I did this is my second time doing. I
Mhm.
did from one patient that we extracted number 8. And then I did the eggshell. And
Mhm.
after tamping, we cut it in the CJ, the tooth. And then I relined the temp. And then I extracted and we did with PRF, socket preservation with PRF.
I've never done that in my life, but I know it's really popular.
Yes, it's super good. And then I put the eggshell in place and we did in the tooth, in the provisional, I did the ovate Pontic.
The tissue molding for the profile emergence.
Yes, and then the
Nice.
patient is gonna place an implant in January.
But they're gonna ruin your tissue.
No, but the tissue we start to doing the
The
emergence.
papilla. Uh-huh.
Yes, for them to place the implant.
Is it gonna be an immediate?
No, because I already removed
No,
the.
no, no, immediate loading. They're gonna put the temp.
No, I'm gonna
Okay, you're
keep
gonna wait.
the.
Okay.
Usually we don't do immediate there. We do very straightforward case, like implant case. We do is very straightforward. We don't do sinus lift. So
Mhm.
when it's not too straightforward, we refer. We are like a general.
The good thing is that you learn the basics, and I think if you
Yes,
take one CE, you can incorporate both things.
yes.
That's what I think.
We do our surgical guides, exocad,
An
and then
exoplan? Oh my God, the
yes,
thing is crazy.
yes.
I'm just learning that. So for me right now, that is a
No, it
spider
was
web
very difficult to
to
because we
learn.
class with a technician and it was super difficult to understand. But
Hmm.
then we have more classes. We have some people in our group, in my class and in the other class that they knew a lot. They learned more, they have more experience, so they gave class to us.
Oh,
They,
that's nice.
yes, and they help us when we are doing something. So little by little, everyone.
Hmm. What specialties your classmates have?
We
The
have
ones that are with you.
we have orthos, we have endo, prosto, perio. What else? I think just that.
But
Perio.
they're all in their countries. They did that, and then they came
Yes,
here to do
yes.
AGD.
Mhm.
And what are the countries?
In my class, three from Brazil and from Venezuela and three from Cuba and then one from Ecuador, Dominican Republic and Colombia.
Nice. So you guys speak Spanish most of the time, basically.
Yes, I learn a
Have
lot
you
of
learned?
Spanish. Yes, I speak Spanish because most of my patients are from Cuba. Almost all the patients there are from Cuba.
Uh-huh.
So sometimes they understand my Spanish, sometimes no.
How's the insurance over there? Like, guys work with, well, here we have Mass Health. I don't know how is it over there. Medicaid, I think.
Medicaid, a lot of Medicaid, but PPO too. PPO, some patients pay out of the pocket because the prices are lower than outside. Some patients apply for lending club to pay.
That's good. But do you think most of them get the treatment done regardless? Or there's like pushback?
Most of them just can do whatever the insurance cover,
Mm-hmm. Same outside in private practice.
but some PPOs are good and pay like at least a part. But some patients they really want to do. It's not all. It's sometimes it's difficult, like to find a case that because there's a lot of patients, but it's difficult to find a patient that they can afford to
Yeah,
pay the
the treatment. Yeah.
treatment.
Polly, do you remember when you took the TOEFL?
Yes, I took five. I talked with you. I say, Chris, what you did with the dog? I can't anymore. I started to look for programs that didn't need TOEFL and I couldn't find.
Many people ask me, like, how necessary is you to
Yeah.
have English? Is like percent for the program. But
When I
then you have patients that speak Spanish, but for the program, you need to
yeah
learn English.
no when I moved to here, like my English was very basic, like very super basic. It
I
was
feel like
very
you've
difficult.
improved.
It's still improving, but improved a lot because my English was, I couldn't talk in English. Like, then I did a lot of course, like studying. And then when I moved, I started to work in a place, but it was a Brazilian place. So
I
I was
remember,
just,
yes, yes.
so when I started to study for the TOEFL, I say, no, I'm gonna uh, in another place that I can speak just English because I need to do the TOEFL and I need the TOEFL. I did the TOEFL five times.
I remember you were struggling, but I don't remember.
Yeah.
Took it. I think I took it like two times because I just wanted to get to 100. But I was stuck in 90s, like something 90, 95. I was like, I need the 100 to get into the advanced standing or they're not going to call me.
Um,
And I got 101. It was literally the best news I ever received in my life that day. I was like, okay, done. I'm never going to have to take it again. And guess what?
you had to take it.
To apply to pros, I had to take it again because they said that, well, only one made me take it again, Harvard. And I took it for Harvard.
Mm.
Turns out that when I sent my score, they were like, well, we just closed the admission, so we don't need it anymore. You made me take it again for nothing? Well, it's fine. Just because I had one, I think I had 21 in reading in the one that I got 101, and they wanted 22, the
Ah, they have
minimum.
a minimum. Like one.
Yeah. I was like, oh, for 1 point, you're going to make me take it again? But I did. So, what do you think in your program is like to have more than a certain amount, like in a certain score?
They, I think they ask for 80.
Okay,
I I think if you have like 80 is like not that good because it's a very competitive program because it's just 12 spots. So
exactly.
if you have a 80 and someone has like what we do is requirements to apply.
Exactly.
Like you have like with um a profile and you have like but the other one has a better TOEFL.
And I got the other one.
Yes.
Exactly.
Like I did I started with 79 and I finished like 96.
That's good.
Yeah.
That's a lot, like 6 points.
Yes. Like just like as many as you needed. And don't wait too much time. Like because I have a friend that is in the first year. Do you know how many times he took it? Yes. Guess how many times do you think?
12?
22 times. Yes.
Wow.
But it's about that. Don't give up.
That
Right?
is like,
Yes.
wow, Polly. Well, I have
Mhm.
another friend that also took it like times. So just whatever
Don't
you
give
need to,
up.
whenever you
Yeah.
need to take to get the score you need, do it.
Uh,
Oh my God, that's a lot. Wow. But good thing that she's in or he's in and
he's
he got it.
in.
Yes, that's the
Yes.
most important thing at the end of the day.
This
Exactly.
process is about don't give up. I have another
Exactly.
friend that is in my class. She went to the interview 4 times before getting
In this program or another program?
program.
The same program?
Mm-hmm.
Hmm.
Went 4 times.
Remind me, did you get in on the first cycle or you did 2 cycles?
I did one.
And you applied to multiple AGDs or you did some advanced standing?
No, I applied. I didn't apply too much because I got the TOEFL like
Mhm.
at the end of the year. But I want to go to EAGD to UF, and I applied to UF. I applied to BU. Did the interview over there. I think I told
Mhm.
you. Do you remember when I got
I
the?
remember. Did you take the interview?
I yes,
Okay. Did they
but
ever reply?
no, I sang the wait list.
Okay,
Like
just remember they accepted you in UF and then like 2 weeks later they send you the wait list. Is what like that?
yes, and then I wrote an email like that I was already accepted, and I
I'm so
applied
glad.
for yeah
I'm
for.
so sad that you couldn't come to be with me, but I'm so happy you're learning a lot. Like
Mm,
I think if I had to do it again, probably I would have still do the advanced standing just because I wanted to do pros. But at
mhm,
the same time, I would have liked to AGD in a way, just to get some different exposure.
mhm,
Because advanced standing was like the same thing that I had already learned in Peru. But at the same time, I think I got more efficient in my procedures because of
mm.
the loops mainly and the repetitiveness of BU. Because they
And
make you do the same thing over and over and over and over until it's perfect.
good.
So I polish myself a lot with hand skills, and that's what I like.
No, and you guys have like a lab, like right?
Yes, the lab is
Yeah.
huge. It's huge. I learn a lot, like my hand skills, my patient treatment in the way of building rapport with the patient, talking in English the whole time. I think I learn a lot in different
Mhm.
ways.
No, it's really good. Won't be you because they have like a incredible, a lot of technology.
We have a
Mm-hmm.
lot. Well, in AS, we didn't see much the technology. We saw the lab, but let's say the printing machines, the exocad, the mill machines, we see more of that in pros comparing it to AS. It's
Mm-hmm.
very little the exposure that we have to milling machines. We can do the same day, but they prefer we send the crown, like we do zirconia instead of Emax.
Yes, we do there too. We have, and I prefer sometimes to send to the lab because we don't have time. Like
Mhm.
it's a lot of things to do, and sometimes it's difficult to have time to do the crown.
And design it to
Yes.
place. And I almost had microwave it, but put it in the oven.
I
Yeah,
did one
it's
today, like say delivery max, but like stay the whole morning with the patient because to scan, and we have an old
mhm.
scan, so we scan like
Slow. Is it
yeah,
a Sirona, like the
yes,
CAD-CAM type of thing?
Sarah. Mm-hmm.
Sarek? Okay. Have the same one and it's old and it lags. In
Yes.
pre-doc, it lags a little. Sometimes if you were scanning and other people were scanning it across the building, it would
Mm-hmm.
lag too. So you had to have patience, but we have. And that's the
Mm-hmm.
most important thing. No, we haven't,
Yes.
at least.
Yeah, for example, the exocad, they just have one computer for the whole program. And now they have another one, but it's in a laptop of the chief resident. And So sometimes have a line like have an implant. We
Yeah.
have a day of the year that the implants is the surgery procedure. The surgery is like half the price
Oh.
for everyone have the experience to place an implant. So
Mm-hmm.
like a list of patients that wants to put implants, and then but we do our guides.
Exactly.
Sometimes we send to vocal, but the patient needs to pay an extra cost. So usually we do over there.
Mm-hmm.
So like a line, everyone wants to.
It's the same in my program. We have like computers, I think, or six that have the exocad and
Mhm.
exoplan, like same amount probably. And we are 24 residents in pros, and then there is like a 30 residents in perio. And
Mm,
perio places the implant, so perio sometimes want to open exoplan, but pro sometimes want to design exoplan, and at the same time there's like people like for six computers.
mhm.
So it's what you're saying, but it's just organizing yourself or
Yeah.
doing something different. But
But in at least we have the opportunity, right?
exactly, at least we have it. But yours is one computer
A
for 12,
computer.
well, for 24.
Yes, for 24.
That's a little harder. So you guys have the assistants, but you don't have the
Yeah,
exocad.
can have everything.
Exactly. Oh my god. Do you have any friend that is taking the IMBD now?
IMBG. I don't remember. But most of the people that I knew that was taking the already took it.
Mm-hmm.
I don't know. I have. Yes, I have.
Let me
They,
see.
they are studying.
Mm-hmm. You remember when you first moved, well, when you first decided to come to the US, like how's the thought process like? Want to do that over there, like the AEGD here?
Yeah. I was in Brazil. I didn't know a lot about anything, so I went to here to vacations. And my cousin said, like, I have a friend that I know in like in the church that he's doing a program. He's gonna move to California to do a program. He's a dentist and he's gonna start the school. And I didn't know anything about nothing
Mm-hmm.
because it's difficult to find information because sometimes the
Exactly.
information is like most in that time, like years ago.
Exactly.
And it's like it's difficult to organize because it's a lot of things to study. You don't know where to start. And then so I'm gonna ask if I can give you your phone. And this guy he called me and he explained me everything. Like
Mm-hmm.
I'm gonna help you. He said, do you wanna study? I say I will. I said, no, so I'm gonna help you. And he gave me like the books, he gave me a lot of things. He gave me even his study plan.
Wow. Very
Yeah.
organized. And then you said, okay, I'll do it.
Yes, I start to study, but then I'm gonna do the exam, and then I'm gonna do the TOEFL, and then I start to look for the program, and then I
Mhm.
start. But when you start to study, you start to meet another people that in the same process, and I think this helps a lot because you start to have information like not only for one, but you have a group that you guys can change information and can
Mhm.
help each others.
Yeah, yes.
Yes.
Being in contact with every person that I have studied with since 2020, I know where they are, I know what they're doing. And it's good to have people like, if we have never seen each other in person, like I know I have you in Florida,
And
and you know you
I,
have me over here.
I don't know if you remember Cynthia, that she was studying.
Yes.
I went in her wedding. She was
What?
living, went in her wedding. And one day, look, this was super fun because I was talking with a girl that just started the program, like the first year.
Mhm.
And I was talking with her, and I said, "Give me your phone number because I'm gonna send a contact about something." And when I put in her WhatsApp, I saw like us talking like in the group that we have. Yeah, and I didn't remember.
Who was it, Cynthia?
No, it was Andreina. I think he already left, already had like the exam. And she told, and the group was like, "You're gonna do your homework."
Can you send the file right now? Oh my god, that is hilarious.
Yes.
That is so funny. Oh my gosh. And me sending 20 stickers probably after that.
Yes.
Oh my God. That's crazy.
Ay, me
Yeah,
was
the world over here is so small.
oh my God. And I was in Brazil. I wasn't even living here.
Exactly. You were working, I remember.
I was working, yes.
You're like, "Wait, Christina, please wait. I just left work. I'll do it. I'll promise." But you were like this. Like you would
Yes.
go from work to study and you were studying. I don't know how you did that.
No, the board one I wasn't studying, I wasn't working because was in the pandemic.
I know, but after, I
Yeah,
think
but the
in part two.
two. So part two is I came back to work, but I wasn't working like the whole week. I think I was
Okay.
like times per week, 3 times.
Yeah. A little hard to do it every
Yes.
day and at the same time put your
No.
whole mind into it.
Yes.
Wow. I can't believe the thing that you just told me.
That's funny.
When you interviewed over there, how was the process? Like, did they ask you, like, was it one on one or was it like a group?
No, they have like a workshop interview like this. So they first we come, they explain everything, and then we did an essay.
Okay.
I don't remember the was, but they asked her to write an amount of words that I don't remember about ethics. It was
Okay.
about and then after that we do our bench test. Was a
You had bench.
yes, was a crown prep, shoe prep with carry excavation, and was a class shoe composite.
Like a
And
CDCA. Are you gonna take the CDCA?
yes, in April, January
Okay.
have a prep like have a course with the program director. They give us class, and we have a mock board,
Yeah, we have that too.
and then after the bench test, we have an exam similar to the board. Yes, I think 100 questions.
Did they tell you they were gonna take an exam?
The exam we knew, just the essay that we didn't know.
And what was the exam about? Like
What
board?
questions?
Okay. Or
Yeah.
like this.
The only thing that if you miss one question or don't complete is fail. But you need to complete the whole exam.
Mm-hmm.
Like it doesn't matter if you like something wrong, but you need to finish the exam
Yeah.
because like management, like do
Mm-hmm.
all. I think
The
we
whole
have.
exam.
I don't remember how many. I think it was from 8:30 to 12. Yes,
Wow, that
the
was
whole
long,
morning.
but it was quick at the same time. My interview for pros took me all day. It was in the morning. So the whole morning was people that were doing research because they don't have the research incorporated in the program. It's either do doctorate 2 years extra,
Mhm.
so 5 years, or you do master's 1 year extra, and so four. And I said, I don't want to do, please. I had already had my experience with research. I don't want to do anymore. So I did 3 years. That's a well, not 3 years interview. I did the normal interview without research, but I had to wait for them to be done with research, with all the people that were applying to research for me to have the interview. So I was there from
Mm.
8 to 5.
Oh my God. But it was because you were waiting, not because you had a lot of
Exactly.
things.
I was just waiting for my turn. But I had a good
Mm.
time. I talked to everybody in the building.
That's
Everybody knew
good.
me by the end of the day. I was like, what else am I gonna do? Yeah, it was
Mhm.
long. Oh my god, I forgot I was gonna ask you. Let me see.
And it was in the same building of the AGG, the advanced standing.
Yes, so the building has seven floors. The
Mhm.
first one is just reception and lobby. The second one is all the residencies like pros, perio, and endo. Third floor is the lab simulation lab, the big one, and fourth floor and some couple classrooms. Fourth floor is OS residency and emergency for the advanced standing or the clinic to welcome the patients the first time they come. They do like a data collection appointment over there.
Mhm.
And then fifth and sixth is pre-doc, like advanced standing and the regular program together, clinic. And then seventh floor is ortho and AEGD. It's
And a lot of
packed,
people.
the building. Yeah,
Yeah.
from head to toe packed. Every corner that you see is busy.
Yes, a lot of people. You guys have space.
Yeah, have space compared to you, I see. Polly, so what would you recommend people that are going through this right now?
Don't give up. Stick to the plan. And like people around that are in the same process, have some guidance because like we didn't have guidance, but it took me a lot of time with the boards and with everything. No, I had guidance from guy that helped me with the materials and everything. He helped me with the because it's gonna take more time to find the things. But if you have someone that can help with guidance, with the exams, like materials, and a group of people that are in the same boat of you, it's really good because a lot of people help me in the
You
way.
didn't even know, yeah.
Even in the application, like difficult, there's a lot of details. And like I meet people that after they and I didn't know that I'm gonna need help and they help me experience here. Sometimes we are in our countries and we don't imagine how it's important having the experience here. I think maybe most for the AEGD, like my program, most of the residents have experience as a dental assistant, as a hygienist, because the dynamic is completely different.
It is. Like the country that you come from, it is.
Yes, super different. And the systems, like in the computer system, is super. We don't have this.
Is it like in Peru that you go to the dental appointment, you sit down and open your mouth and that's it?
Yeah,
In
you have a
Brazil?
paper to look. You're gonna did. You need this, and you write
Uh-huh.
thing. Now it's
Exactly.
better. Now it's better, but
You pay at the end.
yeah,
That's it. If the patient doesn't have money and runs away, you're doomed. It's your problem.
yes, exactly.
Yeah.
Thank you, Christy.